in industrialized nations in North America, Europe, now CML really is a chronic disease where patients can have a life expectancy which is pretty much near normal. Unfortunately, most of the world with CML basically has poor access to drugs and to diagnostic measures. And so we've had a continued effort and a very interesting partnership of nonprofits, academia, pharmaceutical companies, and biotechs to sort of outreach to areas of low resources. And so what this is it involves kind of a network of 4 groups. The Max Foundation, named after a young man who died of leukemia a while ago and started by his mother. That organization basically finds CML patients around in the developing world, and physicians that can take care of them and directly gets a drug and distributes it to those patients. The other links in that chain are academia, my own lab, which has been working on ways to do testing both at site and remotely, so they will qualify for free drug. The pharmaceutical companies who offer the free drug, and the biotech companies who have partnered with us to make some instrumentation that can be done technically pretty easy to do on some of these sites. And the results are actually spectacular. There's been over 60,000 patients treated around the world who were diagnosed and were given then free drug for life. And we've recently done some survival analysis, and people on this program really have the same survival as people treated in Western industrialized countries. So it's a spectacular program with spectacular success. The real pitfalls in doing this operation obviously are, finding the patients, which the Max Foundation does with sort of a network of participants, doctors and physician and patient advocacy groups. But where we come in is the diagnostic issue, because diagnostic tests in CML are fairly highly skilled. So the first thing we did was work with this company, Cephia, to design sort of a cartridge-based assay where it takes very little technical expertise. You basically can get blood, do one step, put it in the cartridge, put it in the machine, and get the answer within 2 hours. But the other thing we've been working on are ways to do this in areas of the world that don't have electricity, which is considerable. And we've done this in 2 ways. One is by showing that you can actually put blood on a special type of paper and send that really by snail mail to a central lab and have the assay performed then. This allows for batching of tons of samples, whereas with a fresh blood sample, you have to basically take it and send it by air express across the world. And that takes about $500 from Africa to Seattle. These dried blood spots can be sent, 20, 30, however many patients the doctor sees a week. And it can take weeks to get here. So for a couple of bucks, you can send a ton of tests. So it's really pretty scalable and very cheap. And then there's also work going on with actually ways to capture blood without syringes, kind of a non-invasive device that you can put on the arm to capture blood to put it on a spot. And we're also working on devices that can actually run without electricity that would actually allow for point-of-care diagnosis and monitoring of CML patients. So really all this unique partnership has really transformed patients in these developing countries from a disease that would surely kill them without medication in 5 to 7 years to really a chronic disease where their lifespan would be exactly what they should expect to go if they showed up with CML in Seattle.